diabetes mellitus, commonly known as diabetes, is a disease caused due to high blood sugar. In this disease, main role is performed by insulin hormone. This hormone is responsible for balancing blood sugar level. In a diabetic person, either the body is producing less insulin or it is unable to use insulin. In many cases, if untreated, diabetes can cause damage to eyes, kidneys and other organs. There are 3 different types of diabetes. Number 1. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder in which the immune system destroys its own insulin-producing cells in pancreas. Number 2. Type 2 diabetes, caused when body becomes resistant to insulin, and sugar builds up in your blood. Number 3. Prediabetes occurs when you have high sugar level but not that high for a diagnosis of type 2 diabetes. Number 4. Gestational diabetes. Gestational diabetes is high blood sugar glucose that develops during pregnancy and usually disappears after giving birth. It can happen at any stage of pregnancy, but is more common in the 2nd or 3rd trimester. A rare condition called diabetes insipidus. It is an uncommon disorder that causes an imbalance of fluids in the body. This imbalance leads you to produce large amounts of urine. It also makes you very thirsty even if you have something to drink. Is not related to diabetes mellitus, although it has a similar name. It's a different condition in which your kidneys remove too much fluid from your body. Each type of diabetes has unique symptoms, causes, and treatments. The symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Increased thirst, weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, unplanned weight loss, frequent urination, frequent unexplained infections, dry mouth. Other symptoms are, in women, dry and itchy skin, and frequent yeast infections or urinary tract infections. In men, decreased sex drive, erectile dysfunction, decreased muscle strength. Gestational diabetes. Most women with gestational diabetes don't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between the 24th and 28th weeks of gestation. In rare cases, a woman with gestational diabetes will also experience increased thirst or urination. So what are the complications if you are diagnosed with diabetes? Complications associated with diabetes include heart disease, heart attack and stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage. In case of gestational diabetes, it may result in premature birth, higher than normal weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice, stillbirth. The mother can develop complications such as high blood pressure, preeclampsia, or type 2 diabetes. She may also require cesarean delivery, commonly referred to as a C-section. The mother's risk of gestational diabetes in future pregnancies also increases. If you have diabetes, you should try to keep your blood sugar level as close as possible to that of someone who doesn't have diabetes. This may not be possible or right for everyone. Check with your doctor about what the right range of blood sugar is for you. There are 4 things you need to do every day to lower high blood sugar. Eat healthy food. Get regular exercise. Take your diabetes medicine. Test your blood sugar. People with type 1 diabetes need to treat it with regular injections of insulin. People with type 2 diabetes can sometimes manage it with insulin injections, non-insulin injections, pills, diet and/or exercise. If you develop diabetes, your main task is still to keep your blood sugar under control. But you also have a new goal of preventing complications. In order to prevent complications, your doctor might make these recommendations. Lose weight. Stop smoking. Take aspirin regularly if you are at high risk. Use medications to control high blood pressure or unhealthy cholesterol. Keep your feet in good condition. Even small blisters or other small injuries on your feet can grow into serious problems. With proper self-management and good education, people with diabetes can live long, healthy lives. If well controlled, it should not detract from their quality of life but will require some adjustments to their daily routine. For more updates, subscribe to this channel and hit the bell icon.